2 to 3 days a week for each. You do a good number of procedures in the clinic too. Depending on your niche of ENT, you're a lot of times doing outpatient surgeries. So you're not in the hospital as much. You're not having to spend as long hours in the hospital, have long days, compared to someone who sees a lot of sicker patients or patients that need to be in the hospital for a while. Also with ENT, I saw my mentors there, the attendings and residents, that I really click with, where they seem very smart, but also balanced individuals, had a good work-life balance. And then furthermore, through ENT, there's a route to facial plastic surgery. So that I could still, pursue plastics if that's what I ultimately wanted to do. Plastic surgery, really enjoyed it. I think I felt more of a personality fit with the ENT department. Plastics too. It's a little bit longer, base training, inherently at least 6 years. You do the integrated path. You need to learn general surgery your first 3 years. So you don't even really do much plastics until you get through that. And then you might need to specialize more after those 6 years. So say if I wanted to specialize in the head and neck region, craniofacial fellowship, I think might be 2 or 3 additional years after residency. In contrast with ENT, it's a 5-year residency program and then 1 year fellowship, which to me is not too bad, even when you compare to medicine or peds, where you do 3 years of your residency. And if you want to do a fellowship, that's another 3 years or so. Also, plastics cover some other aspects of surgery that I just didn't call to me as much. Hand surgery, very different anatomy there. A lot of wound management, like ulcers. And then too, like the body aspect, breast surgery, abdominal surgery, like tummy tucks. They're fine, but to me, they're not as interesting as the face, in my opinion. For me to medical school, even though I, was lucky enough to do well in school and up and through college, I learned quickly that med school I was very average. So no longer got straight A's. I did average on my step 1 exam. So hopefully I could be seen as a good testament. Plastic surgery is super competitive to match into ENT now is one of the most competitive subspecialties to match into. That for me, you definitely need some baseline scores when you're in med school, to make, the initial cut. But I think I'm a good example of just a product of, having a passion and a strong work ethic. That I think that was the reason behind my success. I wasn't the best applicant, where I ultimately matched at University of Kansas in Kansas City for ENT. And I was really excited to go there. It's a very strong clinical program. You rotate at multiple hospitals. And so I knew it was going to give me a solid, well-rounded training in ENT and also exposure to facial plastics as well. Throughout, my training, that's the toughest part of your career when you're in residency, balancing call and really learning, all that educational material, like as if it's a fire hydrant, coming at you. Essentially, I tried to be as open-minded as possible, but really facial plastics, was what still suited my interests and vision for what I wanted in a career. I think it's interesting. What I've come to learn is, when you choose that niche of medicine, it's not necessary just because you're most interested in that aspect of medicine, but also if it suits your personality characteristics. You'll see or have seen already with other physicians that have, come on and spoken and presented to you, like there are certain stereotypes. You have your radiologist. They're very visual. They're super smart, at reading images. They don't mind not, having patient relationships and sitting in a dark room all day. That's just something that I couldn't do. Emergency medicine doctors, we like to joke that maybe they're ADD because they, every patient that comes in is different. So that's the kind of exciting novelty to them. For me as a surgeon, I like to work with my hands, very procedural. I think you have to appreciate that. And then particularly for plastics, I'm very meticulous, detail oriented. Sometimes that is my weakness if I don't see the bigger picture from time to time. I don't mind suturing. some surgeons, could bypass it, but to me, the scars, for a patient really matter. I think based on my own childhood surgery experiences. And I appreciate attention to detail. I'm a perfectionist, so I think that goes well with being a plastic surgeon. I also have come to be somewhat okay with my most challenging patients. So I always think if you can handle the most difficult patient in that specialty, then you're going to likely do well in being that type of physician. So for me, the most difficult patient is the high maintenance cosmetic patient. Some days, makes me question what I do, but at the end of the day, I still really enjoy what I do, even if it's more on the cosmetic side now. I think helping patients to, restore some confidence, make them look good, feel good. You see them come back and they're smiling, they look more confident. It's great. It's such a nice sense of immediate gratification. And for me too, I would say I'm an impatient individual that probably goes along with, the surgeon persona, but it just goes a long way. It gives that sense of reward, satisfaction for being a surgeon. So I ultimately, after residency, did a 1-year fellowship in facial plastic surgery in Chicago. It was mainly cosmetic based, and then, wanted to come back to the East Coast. So found myself, first with a job at a dermatology group in the Philadelphia area. Unfortunately, it didn't work out. I then became an independent contractor. And then actually now, just how things have been going in my still fairly young career, I decided to open my own office. So officially, as of this month, I have my own office and in the suburbs in Wayne. And then I still with a dermatology group 1 day a week in Center City, Philadelphia. It's just been nice to have that broad appeal. So when it comes to facial plastic surgery, you would think, okay, it's a very singular field within surgery, within medicine, but there's so many different procedures that facial plastic surgery covers. So it's even hard for someone to, be a jack of all trades within facial plastic surgery. A lot of us happen to then, be a specialist in only a niche within facial plastic surgery. Also keep in mind that there is some overlap with other medical professionals. For instance, your cosmetic dermatologists who also are doing injectables, cosmetic skin resurfacing procedures like laser. Oculoplastic surgeons can also do injectables, laser procedures, eyelid surgery. They are those who trained in ophthalmology and then did a plastic reconstructive surgery related to the eye, the eyelids. And then there's overlap with general plastic surgeons when it comes to the face, that general plastic surgeons can do a lot, but facial plastic surgeons do as well. So when you think of facial plastic surgery, you have both the reconstructive and the cosmetic side. The reconstructive side, that includes facial trauma. So if someone comes in, they have a cut on their face, they break their nose, they break their jaw, other facial bone fractures. So we can come in and help repair those issues. Also with reconstruction, skin cancer reconstruction is a big deal. There are Mohs surgeons, those are dermatologist surgeons who can take out a skin cancer and look at it under a microscope live so that they can create the smallest defect possible in the office. If they feel like the defect is too big for them to close or in such a delicate area in the face, they refer out to a facial plastic surgeon to do that reconstruction, that closure. Bigger skin cancer defects of the head and neck. So think those maybe with a history of big alcohol or smoking abuse. These might say have a big cancer of their tongue, their jaw. They may require a much bigger reconstruction, like a free flap reconstruction. This kind of reconstruction can be covered by ENT trained head and neck oncology surgeons or facial plastic surgeons or plastic surgeons as well. Free flap usually means you can take tissue, say from your arm or your leg that includes skin, muscle, even bone, and then you transplant it into the wound here. You have to reconnect local arteries and veins, and you make sure they're in the hospital for up to a couple of weeks to make sure that the flap is surviving and the patient is doing well. Also on the reconstructive side, you have your congenital conditions, cleft lip, cleft palate, vascular malformations. My condition that required reconstructive work. So these can be covered by facial plastic surgery. Now, if you're someone who is really interested in craniofacial in these congenital conditions, they have been historically covered by majority plastic surgeons around the country. So I would recommend, if this is what you really want to do, you may likely have more opportunities to do this if you do a plastic surgery training instead. There are some facial plastic surgeons, who are known across, but it's just more in a minority. And there's sometimes, some battles there because the history of plastic surgery reigning over this aspect of reconstruction. And then also facial plastic surgeons can help take care of facial paralysis patients. These are patients with, facial asymmetry, where it's just a weakness or total paralysis that can be due to a congenital issue, trauma, maybe from a complication from a surgery. They have a tumor that caused it. So we can do non-surgical or surgical procedures to help restore symmetry to the face, as well as even some function to the affected side. On the cosmetic side, a big component is rhinoplasty, and it's rhinoplasty, septorhinoplasty. So someone who's ENT trained, I really understand both the form and function of the nose. I think that's an advantage for us as facial plastic surgeons when approaching rhinoplasty. It's one of my favorite procedures, but one of the most difficult procedures in plastic surgery, because it requires both a mathematical and artistic intuition, and as small as a millimeter change can make a big difference for the nose. So, patients can just get a rhinoplasty to improve the outer appearance of the nose. They can also undergo maybe a septorhinoplasty if they have nasal breathing issues as well. That could potentially be covered by insurance. Aging face surgery. These are patients who want to undergo surgery to be, to look younger. That's facelift, neck lift, eyelid surgeries of both upper eyelids and lower eyelids, brow lift, can add on facial fat transfer, CO2 laser resurfacing. So I do all of that, and that's a good staple of, especially from the cosmetic side, for facial plastic surgery. I also see a number of younger patients in the niche of facial contouring and jawline contouring. You can use injectables, so there's a whole non-surgical side to the cosmetic aspect of facial plastic surgery. Injectables like Botox and filler to help with facial rejuvenation, but also to help contour a person's face so they can look more defined, more youthful, maybe even more feminine or masculine. On top of that, you can add surgical procedures like liposuction to help improve jawline definition, buccal fat removal to help slim the face. So those are some of the procedures I do, as well as the cosmetic side. And then there's a whole track of gender affirmation, facial feminization surgery. I unfortunately didn't have formal training in that niche, but I do have colleagues who perform procedures in that aspect of facial plastic surgery. So currently right now, how my, track of my career track and just a couple of years in practice has led me to mainly on the cosmetic side. And I do miss the reconstructive side. Sometimes it is easy not to have to deal with insurance in terms of reimbursement and such, and so that I'm a cash only practice. For me as a private practice owner, there's pluses and minuses to being in private practice versus, say, being in academics or being like in a bigger hospital system. If you're academics or hospital system, you are more, treated like an employee. So your hours are more set, but not, you might not have as much control over them. You may be able to leave work more at home, but always just think, as a physician, we always have to put our patients first. So even if I say, oh, I have hours from this time to this time, you have to then think about, when do I chart, for patients? When do I call patients back? When do I see patients on call if they have an issue? What are the other aspects of the practice I have to take care of outside of seeing patients? So just never think like being a physician, it's never a 9-to-5 job. The only thing that's closest to it is if you're in emergency medicine or a hospice where you're purely doing shift work and someone else is taking over your patients, so you can really leave work at home. Also in the academics and the more hospital or bigger hospital group environment, so you might be seeing patients who are sicker are more likely in the hospital, so be spending more time there. You might have lesser control in terms of how much compensation you can make, because there's certain overhead and such. And again, just being like an employee status, you're going to need to take call, but a lot of times it's a bigger group, or if you have residents, it's not as intimidating, even though again you might see the sickest patients, because the patients who really need care are going to come to the hospitals, especially the academic centers. In academics, you have other pressures like research to consider, but then as a cosmetic surgeon, for either these two ways of profession, you don't have to worry about like hiring and firing employees, marketing. That's all left to your bosses, those who actually manage or run your practice. For me now in private practice, with it just being me, I don't currently take ER call, so I only take call for my patients. So that means I don't go to the hospital to see patients before, after my usual hours. I don't go in on the weekends unless it's my own patient. Typically, I'm in the operating room 1 to 2 days a week, hoping for it to be more like 2 or 3 days, where you start in the operating room at 7:30 in the morning. You might have just one case, or you could be done more like at 1, 2, or 3 o'clock or so. If it's long case, it could be done at 4. The other days a week I'm in clinic, usually from 8 to 5. And again, if it's a busy day, then you have to add on the extra time to wrap up patient notes and take care of any other patient tasks or other issues at hand. The pluses of being in private practice: you can dictate your own hours. You can also have the ability to make more money because you're controlling your own overhead. You're pricing the kinds of procedures you do. The call schedule is easier. It's even though I have to be on call for my patients, so I need to ask for someone to help cover for me when I am out of town. And you have just more autonomy. At the same time, though, when you're in private practice, and especially if you own your own practice, you have to worry about all the non-medical side, managing your employees, hiring and firing, marketing, other things like whether it's ordering supplies. I'm in the process of having to renovate the office too. So looking into that, it all takes time, that you're not otherwise making money. Also just think, if you are away from the office, not only are you not making money, but you're losing money, because you're paying rent, or you need to pay someone to keep the office open. So there's considerations there with private practice. And then, I also want to mention too, that I'm a fairly new mom. I have a 16-month-old son who was born right before a shutdown. So I'm also happy to help answer questions related to, being a surgeon mom or a female surgeon in medicine. I think it's important for, those females who are watching, to have a discussion about those considerations as well. So I think I've talked for a good amount of time here. Hopefully, that covered a good amount in terms of facial plastic surgery and what my current practice is. I'd love to open it up for questions at this time.
Yeah, definitely. So we got a couple questions before the session, and one of our questions is, how do you deal with patients who are nervous, or even dealing with your own nerves about procedures?
That's a good question. So patients who are nervous, I think always think you want to treat every patient the same. And that includes, treat them like your mom, or your sister, because I think that goes a long way to always put the patient first. And then for those patients who are particularly nervous, education is key. So you always want to make sure you're informing them about, educating about their anatomy, like what, findings I'm seeing on exam, and the recommendations and why, and what the treatments do. And especially, not only for patient education so they understand, but to make sure that you have some established good expectations between you and the patient, that they align still well with their treatment goals. And and just think also from a legal liability standpoint, you want to make sure they're informed of the risks, whether it's just a written consent, but also verbally. I feel like for me, taking the time to be thorough with verbal education goes a long way. It minimizes phone calls later, like say even just from a filler injection. Oh, like I'm concerned about swelling or bruising. Well, if you tell them up front, like, hey, you're going to swell, you're going to bruise, it's going to be okay. I want you to call if it's significant, but anything that just helps to make the patient feel better and feel like they're, really part of that educational process and understand, and also too to make your life a little bit easier, when it comes to patient expectations and satisfaction of the results, and also for patient phone calls. So those who are nervous, again, I try to spend the time when I can. Sometimes it's hard, especially if they have unrealistic expectations or they interrupt you, but you try to, be patient, to take the time, and a lot of times to listen and to talk. Always make sure to ask if they have any questions. If they are so nervous that they're unsure, it's always okay to say, let me give you some time to think about it, and you can come back when you're ready. To not be too pushy, especially in my field where it's cosmetic medicine, patients are paying for it. This is not like medically necessary procedures that we have to do. So it's, I have also, come to appreciate too for my patients, trusting their face in me is a big deal. Your face, that's like the window to yourself. And so I want to be as approachable and relatable to my patients as much as possible, for them to be able to confide in me, tell me what they're most concerned about, what they feel most comfortable pursuing. That's a big deal, regardless of how nervous they are. Now, in terms of nerves for procedures, yes, there are times where I just, feel anxious, like, okay, this is a tough case ahead. What did I sign up myself for? A lot of times surgery, especially if I haven't done a certain procedure in a while. I think what helps is, for me, taking the time to review for each case still. So I'm a young surgeon still building my practice. Some surgeries I'm like, okay, I need to quickly review things, not too late. Some I have to just put the time to reread, my notes from fellowship, reread some textbooks to go over, and even write out a plan, my notes of, hey, this rhinoplasty, these are the steps I'm going to do today. So at least I have this reassurance, I have a fallback. If I forgot, I'm not sure about a step, then I have these notes. I'm a very visual person in that way. I have really great mentors that if I was really in an urgent, situation, really needed help, I know I could call, them, for any reason, even in the middle of surgery, which I know, you wouldn't try to, especially if it's not like a medically necessary surgery. And then, too, I think just through the process, especially if you're getting frustrated a part of the surgery or it's not as going as well, sometimes just to take a step back, take a deep breath, or try to go to another part of the face or another part of the process. You could talk it out, with your scrub tech, your assistant. And then, I like to have music in the OR. I think that, puts me at ease as well. You can always, if needed, take a step back and just to let yourself to reevaluate, get a little distance, and then go back into it.
Thank you. That was a really great response. Our next question is, what do you think would be better to, balance your family life, your personal life, and also your career, working at a hospital or a private practice?
I think there's pluses and minuses. It kind of depends what niche of medicine you're in. So again, if you're working at a hospital and you are an emergency medicine physician or a hospitalist, those are, I think, the best ways so that you can really leave work at home, that you can do shift work, where say you work from 7 to 7, and then once you leave, you're done. Of course, then you have to think about, are you okay with working night shifts? You might have to work a number of shifts in a row, and then you take a week off. So the schedule is kind of funny, but those physicians are the ones that I see that they have the best balance in terms of, that they have, it's very black and white. At least for me, seeing as an outsider, that when they're at work, they're at work. When they're at home, they don't take call. They're not doing anything to otherwise manage the practice. For if you're someone in plastic surgery, asking if you should work for a hospital or for a private practice, I think it depends on how much risk you want to take on. So if you work in a hospital, you have your support staff, your marketing all built in for you. You have patients, already that are going to be on your schedule. You have certain work hours. You might not have as much control over it. And it's also too, how much control do you want over your schedule, over, your, how much you get paid. So risk and control and autonomy, I think, are the key things. If you want more of that, then of course you have to take on more risk and responsibility. So, if you're content with that someone else handling these things, the extent of your pay is fine. You don't feel like you want to make more for the time you're putting in and such. Then I think being at a hospital is a good thing to do. And especially if you want to do more reconstructive work. I think for private practice and just how my track was it wasn't as if like I always knew I wanted to do my own private practice, my own thing, but it was more of, I was not getting enough support, not enough surgical referrals, and not feeling valued enough for what I was doing, being part of other practices. And so now, even though it's on me to, take care of the marketing, put in the extra time, I have to fire employees and train them and just start from the beginning. It's exciting that this is like my own thing. It's how I want to do it. I have total control over it. If I only want to work 3 days a week, I can, or I can work 5 days a week. So I can hustle as much as I like. I get, more, I have to pay directly for my overhead, but I get more pay of every patient, that I see. It's coming more to me. So, I think it just comes down to kind of what your personality is and how much control, autonomy, risk, you want or are willing to have.
Awesome, thank you. So our next question is, how many years of schooling did it take to get to where you are today? Is there any special training required for a plastic surgeon beyond med school?
So after med school, I did 5 years of ENT and then 1 year of facial plastic surgery fellowship. So that was 6 years total. You can always do more, to subspecialize. But I think if you go the general plastic surgery route, if it's the integrated program, it's a 6-year residency and then plus fellowship if you want to do more. So that could be 1 to 3 years. If you go the general surgery route, because there are still some programs in the country like that, you do 5 or 7 years of general surgery first, then you do your 3-year fellowship in plastics, and then you might specialize further.
Perfect. And we just got a question through our live, and they say, thank you for an amazing session and congratulations on opening your new practice. I'm a grad student at UNC. I was wondering how long you study for the MCAT and would appreciate any prep suggestions. I'm also a non-traditional female applicant who will be applying next cycle. Do you feel like it would be difficult to manage family life in med school?
Those are great questions. So yeah, thank you for the well wishes. So for the MCAT, so I'm pretty far removed from it. I would say that was like the toughest exam that I went through, kind of like a wake up call for me. Just because in college I started to be used to being able, I would just admit it, like cram for tests, including like organic chemistry, just like for a couple of nights before, and still did well. I had some AP credit going in, so I was able to do all my pre-med classes, including physics, and be done by the end of sophomore year. So I ended up taking the MCAT early the summer after sophomore year. I ended up taking the MCAT 3 times. The first time, I was like, oh, I think I can do better. The second time I did worse. And then the third time I had to take to like make myself look a little better. So if I could do it again, I think the MCAT is that first test where, and maybe because I had some confidence going into because I had done well in undergrad, this is where you're in a different tier of individuals. That, there's some people who are just going to be really good test takers, or some who are just super book smart. And I'm just not one of those when it comes to, especially amongst my medical peers. I'm someone who I think prides myself on my work ethic. If I were to say how I stand out a little bit. So I think most students do this. It's good to do a study program, like to buy a course. So I did Kaplan because I think that gets you on a schedule, and you can determine for yourself if the classes in person or online are helpful or the books are helpful. But I think that gets you on a schedule, a structure. I think for me, I started to lack that structure in college, and med school, I studied enough. I knew I learned early I was average. Me studying more wasn't going to do anything. I did struggle a bit in terms of, figuring out how to study in residency too, because it's all on you. You're otherwise working, and I'm just not that person who can just sit down and read for hours from time to time. So I think if you start early, it's always good. The better you have that discipline with studying, and I think with you being a grad student or just a little further out from undergrad, you have a more mature understanding and appreciation for that. I think compared to someone like myself who went straight through undergrad and med school, but having a good, study schedule. So, you're covering everything you need to, you're putting enough time for practice tests is key. And if needed, definitely take a course. If you have other peers who are in the same process as you, it's always good to have a study group. And I think especially later when it comes to med school, which I wish I'd done more, and I did it more so in residency, is to really do a lot of practice questions, because too, a lot of times you're going to come across content that you have no idea about. So it's best how to figure out how to handle your time management with tests and how to answer, whether it's an easy question, you may want to slow down. Then these are testing tips that I learned in residency when I sought some professional help. Easy question, you want to make sure you take a little bit more time so that you didn't carelessly answer the question before you move on. A question that's super difficult, spend very quickly on, because you're just mostly guessing. Give it your best shot and move on. You don't want to be sitting there, and adding extra stress, anxiety, and extra time when you could be focusing on the questions that you are best have a best chance to answer correctly. So I think, learning good test taking skills will go a long way. And then otherwise, just keep at it. I think even since I was in med school, the average age of med students is increasing. I think med schools are wanting to look for students who are mature, who are focused. I see that more in students who've taken time off, because you have more of that, worldly or life experience or perspective instead of going straight through. And when it comes to, I'm not sure where you're at, if you already have a family or you already have a partner, having a good support system is really important. I could have never imagined having a kid in medical school or residency, but it's possible to do. I can only imagine how tough it is to be isolated when you're studying. And again, I think if you find, as long as you can figure out the right support system, whether you lean on your parents or, other family members or friends, that's, key. And that your partner with you also understands, what you have to go through in that chapter of your life in terms of training for school.
Perfect, thank you. Another question that we got, how many other plastic surgeons / healthcare workers do you collaborate with or work with during a surgery?
That's a good question. So currently, I only operate solo, because usually there are cosmetic patients who just want to do surgery with me. I can cover a number of issues with them. Sometimes it's harder to link up because the two surgeons need to have same privileges, the same surgery center. But there's a possibility of, say, if I knew someone who is a body plastic surgeon and the patient wanted breast surgery or abdominal surgery at the same time, that maybe we could do surgery at the same time, or one after another. Of course, if you do one after another, that prolongs the surgery more. More so, I think if you are doing reconstructive cases or in academics, that's where you can collaborate more surgeons. As I mentioned, if you do Mohs reconstruction, skin cancer reconstruction, that's where, they don't have to be done the same day, but those, if it, they done within a week, where the Mohs surgeon refers to you, the patient with their defect to be closed. The free flap surgeries that I mentioned earlier, those are done in live. So you have the one surgeon come in who takes out the cancer, and then the second surgeon comes in after that's done to reconstruct the defect. If, again, more so in academics, when you have those challenging cases and unique cases that you could have, say even for like trauma cases, for instance, You cover the facial trauma, you might have like orthopedic surgery or general surgery doing surgery at the same time, or staggering that they're all involved at some point in the case.
Sounds good. And another question we got, how do you find time for hobbies and interests with your job?
So right now it's difficult, just because we have a young son at home, and just with the pandemic, and my husband, he's been luckily been able to work from home. So I rely a lot on him, but I also have to be mindful of that. It's not like, in other times it was just me and my husband, or if I was like single, I, could say, oh yeah, like let me go grab a drink with a colleague or dinner after work, especially if I'm in the city. I have a colleague that I'm close with, in Center City, where we work together on Thursdays. But just knowing like, okay, I have a husband and son at home, my husband too, like he's more isolated just working at home. It's a lot of times best to, and he takes on a lot of caring for his son, to come home, to spend that extra time when you can, because I've been otherwise gone all day, all week. Um, I think, what we do, or what I try to do, I'm a planner. So, I'm not good about shutting myself off from work, if that makes sense. Like outside work hours, like at night after I put my son to sleep, I try to finish responding to some emails, or at night. On the weekends, I try to catch up on some work, because there's always something to do, especially from a marketing standpoint. But I'm trying to make an effort to, schedule long weekend trips here and there, so we can take a little time away, even if it's not a full week at a time. We really like food, so whether it's cooking or going out to eat. So occasionally, even if it's like going to schedule to go out for brunch with a couple of friends, we did it a couple of weeks ago. It was a good accomplishment, to get us out of the house, especially with our son, in COVID times, just to have done something social. Both of us like live music, so if times were normal, we would be going to do that, and maybe getting a babysitter. So I definitely say, it for me as a mom now, I take it one day at a time. I have to say it's okay if I don't do as much. I'm not good right now at working out. I need to be better about that. But again, if I work out, that takes time from my son, when I'm otherwise at work all day. I do stress though that self-care and having balance is really important. You might hear or learn that it's really hard to have balance as a physician in general, but I think it's good to, seek out those opportunities to rest, relax, those hobbies that you might have, because at the end of the day, like being in medicine is such a narrow-minded, isolating track, and career path, and it's a long one. You sacrifice so much. You want to make sure that you stay as balanced as possible, because being a more balanced individual will make you a better physician overall.
Thank you for sharing that. One of our next questions is, were you interested in medicine from high school? And if so, what steps did you take as a high school student to prepare for your pre-med classes?
Yes. So as I mentioned from the beginning, I had my own childhood reconstructive surgeries that largely influenced me to want to pursue medicine, and specifically surgery. When I got to high school, I made sure to find extracurricular opportunities to explore that more, make sure it confirmed for me that I was interested in medicine and surgery. I ended up interning for a plastic surgeon, like working the front desk for her. I got to observe some surgery, so I think that was good for me, at least to know early on, okay, I'm okay with being in an operating room environment, seeing blood, seeing people being cut open. I also worked in a hospital ER triage, volunteered there, and got some medicine exposure as well. So I think, in the high school level, yes, you're doing that for your CV, but also to just do it in general. So, it's okay to change your mind. It's okay to take your time when you pursue a career in medicine, but you want to make sure as much as possible that this is for you and for the right reasons. I would say, just like my spiel I mentioned earlier about surgery versus non-surgery, if there's another career path that you like just as much as medicine, I would strongly consider it, because you sacrifice so much time, effort, work-life balance, family considerations, financially, you sacrifice so much. I didn't start my first real job until, I was 32 or so. So it's a long journey. Otherwise, in terms of preparing for pre-med, I took a lot of AP classes, a science one, so that was able to get me credit and test out some of the pre-med classes, so that put less pressure on me and allowed me to be able to work towards my majors earlier on. Um, and I don't have any other advice. If you can afford it in college, major in what you really want to major in, even if it's a humanities major. A lot of times it's easy to major in a science major because it covers the pre-med requirements, but you only go through college once. So just make sure, you're taking the classes you really enjoy or would never otherwise be able to.
Thank you. One of our next questions is how can you get a head start to be more prepared and competitive for the plastic surgery field or just medicine in general?
So I think you want to have the mindset of first exploring to say, is this for you? This field of medicine. So I would, make sure, because again, surgery is very different from the non-surgical fields of medicine. As early as you can in high school or especially in college, you know, see if you can shadow a surgeon, any surgeon or a plastic surgeon specifically, where you can shadow them in clinic, shadow them in the OR to see, okay, do you enjoy these procedures, getting to work with your hands, and again, dealing with cutting people and blood and such. And then ultimately, you want to make sure you don't have to be sold on plastic surgery yet when you're in college, but you want to, build your experience, your CV, so that you get into, the best medical school you can. And hopefully that's one that offers, it has a solid plastic surgery department. This is something to kind of look into. But otherwise, you don't necessarily need to have like, worked a ton for a plastic surgeon or done research or anything like that. I mean, that helps, but really it doesn't help you unless you take time off to do like another grad program or to do some research, but not until medical school, where then you can then connect early to the plastic surgery department if you're still interested then, or you can see if there's any opportunities to, shadow with the residents, the attendings, and even start on some research projects. But a lot of what you do in medical school is going to be most important for eventually applying for residency in plastic surgery.
Perfect. Thank you. Just one of our last questions, so we don't take up too much of your time today. How would you say that you balance life as a mom and also life as a surgeon? Because life as a surgeon is probably a really demanding life. So how would you say you balance both of them?
I think right now I'm lucky that in plastic surgery, the hours and such are not as rigorous compared to other surgeries, especially. So, for instance, I'm not like a cardiothoracic surgeon or a transplant surgeon. So even if my husband will make fun of me and say that I lack work-life balance, I feel at least I'm more balanced than other, specialists who spend much more time at work and especially in the hospital. I'm struggling. I'm still trying to find, how to do this better, but I'm usually someone who's very in tune with my email on weekends. I try if I can to only check the email in the morning and then maybe later in the day, not to keep checking it every hour or so. When I get home, I try to isolate those first couple hours of just having dinner with my family, helping to put my son to bed. And then afterwards, that's when I play catch up with emails and such, but just to at least carve that time out a bit. And then, as I mentioned earlier, like whether trying to plan for things on the weekends or hopefully small trips, so even to say for us to go to the city to get brunch or, to go to a museum exhibit. I think having those things to look forward to is, not only will help us as a family, to spend time together, especially for my husband, myself, and also for me to give some, working towards that work life balance. I do feel grateful though that at the day I love what I do, despite all the challenges I face in my young career. So I am someone who I would say I live to work. My husband works to live. But at the end of the day, and it's okay that your work, you work a lot of hours if you enjoy what you do. I I would hate to think like if I put all this time and I didn't enjoy half of what I did, that I don't have as much meaning or satisfaction of the aspect of my life that I spend the most time at day to day.
Awesome. Thank you so much. Thank you for, speaking with us, and we really enjoyed having you and hearing from you. And yeah, we really appreciate having you speak with us today.
Awesome. Thanks so much for having me. Please feel free to share. So I'd love for you to follow me on Instagram, Dr. Tina Ho. I post a lot of before and after pictures and some of my procedures. Feel free to send me a DM through there, or my email address, twevantinaho@gmail.com, THUYVAN Tina Ho. If there's any of you who are in the Philadelphia area or relatively nearby, I've had some students approach me from other sessions to shadow, so I'm definitely open, to helping promote those opportunities, especially since I know it's such a weird time right now.
Perfect. Perfect. Thank you so much. And I will send out your information again if anyone just wants to reach out with any additional questions. But yeah, thank you so much for speaking with us today.
No worries. Thanks so much for having me. Take care.
You too. Bye-bye.